Stacey Jakes is one of the faces behind the statistics. The 44-year-old fitness instructor from Sheffield has been waiting since last summer to find out when she'll get the surgery she desperately needs.
About the end of July, beginning of August, I went into what's called retention. So basically I couldn't wee for about 5 days, and the pain was excruciating. It transpired that I'd got fibroids, and I must have had them a while because they were huge.
Stacey now has to work online and has been told she's not a priority for surgery. She'll need a hysterectomy, and drugs she's taking have brought on an early menopause. There's no hint as to when she can have her operation. It could be months as the NHS deals with a big backlog.
The uncertainty, I think, is a big thing. Just not knowing when it's going to be. Having surgery looming, I guess, is hard enough, but then not knowing when it's going to be. But like I said, there's nothing. It is what it is, I guess, is the only thing I keep coming back to, because it is.
It's important that people are positive.
Doncaster GP Karen Forshaw has lots of patients on waiting lists for surgery. The pandemic has created a real problem in our hospitals that she says is not going to disappear anytime soon.
So the backlog is huge, definitely. We know that. It's been, different kind of forums talk about this kind of thing all the time, and people are saying things like 5 to 10 years before we actually catch up and get on top of things. And that's just, you can't even imagine that, really, can we? But that's the devastation that the COVID has left us with, really.
Breast cancer patient Carolyn Ashley from York has finally been told her reconstruction surgery can go ahead. She's been waiting an extra 14 months for her 4th procedure to be completed.
It's just, it's 4.5 years of it. Every time I get dressed, I'm reminded of what's gone before and what's still to come, really. I just would like to get to a full stop on the surgery part of things. I'm hugely grateful that I am getting on with it, because there's so many people on the list that have no idea when anything's going to happen.
The NHS says urgent procedures are being prioritised and hospitals are working flat out to get people the treatment they need. Sadly, that's little comfort to people like Stacey, who are having to live with pain and anxiety. Ian White, BBC Look North, Sheffield.